Good afternoon, and I would like to call the special meeting of the BOCC to address emergency management related to COVID-19 and local state of emergency meeting to order. Would the clerk please call the roll?
Good afternoon, Miller.
Here.
Hagan.
Here.
Kemp.
Here.
Merman.
Here.
Overman.
Here.
Smith. Smith. White.
Here.
And County Administrator Wise.
Unmute yourself, Mr. Hardell. Mr. Hardell will be sitting in his place. He didn't unmute himself.
It doesn't show muted on my end. Are you hearing me now?
I'm hearing you now.
I can hear you. Thank you, sir.
Perfect.
You have a
For,
quorum.
County Administrator Wise.
Okay, thank
You have a quorum.
We're now moving to public comment. The Board of County Commissioners welcomes comments from citizens about any issue or concern. Your opinions are valued in terms of providing input to the board. However, it is requested at the same time when you address the board, that comments are not directed personally against a board member, a staff member, or a presenter, but rather directed at the issue. This provides a mutual respect between the board and the public. 20 minutes have been set aside for public comment. Each speaker will have 2 minutes. Our first speaker is Maria Halbrowski.
Yes, good afternoon. My name is Maria Rabowski, and I'm a Hillsborough County resident from District 2. I'm speaking today to implore the board to maintain and extend the countywide mask mandate that's been protecting us all for the last 3 months. Like many of you, I've been thrilled to see the number of COVID-19 cases in our county and our state decreasing since our horrific peaks in July and August, but this threat is far from over, and we need a continued and unified commitment to comprehensive mask usage. When the pandemic first hit this spring, policies on mask use in our region varied city to city and business to business, creating a disjointed and piecemeal line of defense that was clearly ineffective in protecting the residents of Tampa Bay. We cannot afford to return to those fragmented policies. As you know, today our county has over 41,000 cases of COVID and 600 deaths. If we look at the combined stats of Hillsborough, Pinellas, and Pasco counties, we're faced with over 72,000 cases and 1,500 deaths. If not for the mask mandates enacted by our 3 counties this summer, these numbers would be higher still. And how many of those sicknesses could we have avoided if a unified policy had been adopted earlier in the spring? Study after study has shown that if we all wear our masks correctly, fewer people get sick. And even when people do get sick, studies are showing us that masks reduce the severity of COVID-19. A lower initial viral load thanks to correct mask usage means a shorter illness, a lower chance of hospitalization, and a lower chance of death. I'm sure you'll all agree that the simple act of wearing a mask when we're out and about is well worth the lives we save. As your counterparts in Pinellas and Pasco counties have agreed this week, to relax the mask mandate at this point would be a grave error. It would be to turn the fire hoses off while our house is still blazing, or to pack up the sandbags when the floodwaters are still at our door. The numbers are down not because this virus has disappeared, but because this easy precaution is working. I'm imploring you to continue to guide the people of Hillsborough County with this common sense policy to protect our lives and our livelihoods. Thank you.
Thank you. Jeffrey Kane.
Thank you. Jeff Kane calling today to respond to the BOCC and many community citizens who have asked when to end the COVID-19 emergency. Sandy has gone on the record that she felt a 5% positive test rate should be the signal, which we have finally now reached this week. The BOCC may have missed Governor Ron DeSantis' roundtable on public health today because you were reviewing all the feedback of the citizens you represent. But this roundtable was fascinating as Governor DeSantis assembled 3 of the greatest immunity experts at the premier research universities who have not been politicized, but doing the real research in collaboration with their expert colleagues around the world. 1 was from Harvard Medical School and 2 from Stanford Medical School, including 1 a Nobel laureate. All were in consensus of what we have now learned, that COVID-19 is not as harmful as first feared, since now the research data has been analyzed. Even the CDC has admitted that only 6% of the reported deaths with COVID were actually due to COVID. With the now proven treatments, the survival rates for all ages under 65 is almost 100%. This Thus, it is no longer an emergency pandemic or even a local epidemic. With vaccines coming very soon, people now have the same tools that we deal with every year with the flu, pneumonia, etc. Thus, those with compromised immune systems like the elderly should be considered for quarantine, not healthy people. These experts said that Iceland, Sweden, and Japan that did not lock down and ruin their economies and schools have done much better. In addition, these experts said we have always known that the cloth and surgical masks do not protect from infectious diseases and actually are harmful to people's health. But the physical and psychological fear damage done by masks, especially to children, has been far greater than any risk from COVID-19. Maybe the BOCC members feel we need the COVID-19 emergency money. Is this money really worth the harm being done daily to our kids, people, and economy? No, the BOCC members hopefully would say their votes can't be bought. We don't need to wait for October 1st. A vote 6-0 does not represent the will of the people of Hillsborough County. Listen to the people you represent. Thank you very much.
Thank you very much, sir. Diana Klein.
Hi, this is Diana Klein. I'm calling on the Hillsborough Board of County Commissioners to make a motion and pass that motion to discontinue the local state of emergency order in Hillsborough County and to disband this COVID committee and to resume normal business effective today because the recovery rate of infected individuals is over 98%. At this point, all of you have betrayed the residents of Hillsborough County with your repeated, unwarranted, tyrannical state of emergency order and mask mandate. You have been basing your decisions on junk science that is being fed to you by individuals who are not even treating patients. Your decision to maintain a false state of emergency has nothing to do with the health and safety of the residents in this county. You need to remove yourself out of our personal health care decisions now. We did not elect you to micromanage our health care. You have prostituted yourselves in colluding with wicked men and women and accepting bribes of promised financial gain from COVID testing kits to the ultimate goal of financial gain from the upcoming COVID vaccine. You are a disgrace to humanity and are unfit to hold public office.
Ma'am, hold on, ma'am, if you continue to kind of what you're saying and bashing the members of this body in the manner that you're doing, we're going to cut you off. You may continue, but please don't do that.
Mask mandate has turned parents into child abusers. Stop it now. We, the people of Hillsborough County, are mature enough and smart enough to manage our own personal health care decisions. Get out of our personal health care decision making now. Disband your communist-run COVID committee now. God's word says that when the wicked... Enough is enough, ma'am.
Ma'am, enough is enough. You're now calling us communists. Please, this is my last time. Don't do that, please.
All of you on this board are wicked people in the earth. Repent.
That's it. That's enough. That's enough. Cut her off. I know I'll get some emails behind that, but I don't appreciate it. No one coming in here calling this member of this board, not staff, communists, wicked, and other names that were being called. I'm sorry, members, but I just don't think that's appropriate. I read the comments before and asked them, please don't do that, and she did. I apologize for that, but I had to cut her off. Bert Lithicum.
Florida Statute 25238, Section 3A5 states that in carrying out the provisions of Statute 252, each political subdivision shall have the power and authority to request state assistance by declaring a state of local emergency in the event of an emergency affecting only one political subdivision. However, since the governor's executive order 2052 declared a state of emergency for the entire state, the Hillsborough Board of County Commissioners has no authority under 25238, paren 3A5 to declare its own state of emergency. Check with your county attorney. Accordingly, the March 12th executive order issued by the now abolished Hillsborough County Executive Policy Group and this board's continuous re-extension orders are all null and void and without substance. Further, Florida Statute 252.311 states its legislative intent in paragraph 1. Quote, the legislature finds and declares that the state is vulnerable to a wide range of emergencies, including natural, technological, and man-made disasters. all of which threaten the life, health, and safety of its people, damage and destroy property, disrupt services and everyday businesses and recreational activities, and impede economic growth and development. It's now apparent that the pathetically low mortality rate of this hoax virus, whether natural or man-made, poses no threat to life and health that could possibly justify a state of emergency. However, our state and county governments, by their own responses, have now created a serious man-made emergency that continues to threaten the life and health and safety of the people, damage and destroy our property, disrupt services, everyday business and recreation activities, and impede economic growth and development. Stop acting like tyrants. And if you really believe fear muzzles keep you safe, stop cowering behind your computer screens and resume public.
Thank you very much, sir. Your time is up. Thank you very much. Carolina Ostenberg.
Give me one time, please.
Pardon me? Pardon me?
Can you give me added time? I had a delay.
I'm sorry, I don't understand what you're saying.
Can you hear me?
I couldn't understand what you said, ma'am.
Can you add time? I could not hear you.
Can you hear me now?
Add time, please.
Can you hear me now?
Yes, I can hear you.
Okay, you have
Yes,
2 minutes,
I can
ma'am.
hear you.
You have 2 minutes, ma'am.
Thank you.
You're welcome.
I hope all board members listen to the roundtable discussion that was had with our experts today. It covered the following. It was like a rate instead of cases. The overall survival rate recently reported by the CDC of 99.95 or higher for people under 70. The age group differentiation for virus control, the inaccuracy of PCR testing, the economic impact of quarantining positive cases based on PCR testing, the unwillingness from positive persons to rat out their friends with contact tracing information, the censoring of medical experts who didn't fit the narrative. So why isn't the Department of Health advice go out in the sun or take vitamin B to strengthen the immune system, especially with the flu season coming up? Why aren't you recommending early treatments with safe, effective, and inexpensive hydroxychloroquine and zinc as prescribed by American frontline doctors who were also censored? Why is the Department of Health instead promoting invasive, expensive, and ineffective treatments like remdesivir and plasma therapy? Has a vaccine ever been developed for other coronaviruses, and what were the findings when they were tested? Has any messenger RNA vaccine ever been used before? You justify instructions to flatten the curve so that hospitals wouldn't be overwhelmed. Now that doctors and hospitals are starving for business, why are restrictions still necessary? Won't destroying economies and disrupting food supply chains cause poverty, starvation, homelessness, and poor sanitary conditions? If face diapers and antisocial distancing make you safe, why don't you resume public meetings at the county offices like many other counties? Or are you afraid of facing your constituents? I want you to stop the tyranny orders. I want you to not continue the orders that are already ready to be signed at the bottom of this agenda, and I want you to stop the mask mandate today. Do not sign to continue the orders. Leave the orders as they are at the bottom of this agenda, which apparently have already been planned to be signed. Do not sign the orders. Stop the tyranny.
Thank you very much, ma'am. Thank you. Our last speaker is Kimberly Mitchell.
Hi, good afternoon. This is Kimberly Mitchell from Riverview. Thank you for a few minutes of your time. Last week I called in representing a growing group called Hillsborough Freedom Coalition. At that time, we had 350 family members in our organization. And now, a week later, we have grown to 465 families represented. So I'm not alone when I say, and I echo my request, that you please consider to vote and end the mask mandate. I previously listed the dangers of prolonged mask wearing, and it bears repeating. Masks cause stress, anxiety, CO2 poisoning, headaches, dizziness, sleep problems, rashes, skin breakdowns, impaired cognition, and so on. And we expect our kids to sit in a classroom with masks on all day and expect them to be able to comprehend and think is just unacceptable. And not only that, our very own CDC has admittedly made countless mistakes. Originally, masks weren't required. That wasn't going to do anything. Then they changed their tone and said masks and social distancing were our best line of defense. Now, according to the Washington Post, the CDC had revised itself yet again and said the guidelines it posted on coronavirus airborne transmission were wrong. This article I've emailed to each of you commissioners, and anyone is capable of finding it on the internet, September 20th, Washington Post. All in all, COVID is not deadly to the general public and nor something that people should fear. We would like the freedom to choose. If some feel the need to muzzle up, then by all means, they have that choice. But for those of us who are ready for our economy to return to its normal, healthy state, please vote to end the mask mandate and remove it. Just because we're in the state of emergency doesn't mean we have to continue with the mask mandate. Thank you for your time.
That was our last speaker, so we're going to close public comment. We'll now move to Mr. Tim Dudley, an emergency management update. Mr. Dudley, you're recognized.
Good afternoon.
Good afternoon, sir.
Hillsborough County collection sites conducted over 2,700 tests last week. We continue to see a low demand for testing. Last week, Hillsborough County averaged 377 daily test collections, up 7% from the previous week. We'll continue to evaluate the county's testing sites, locations, and proper right sizing to meet the demand within the county. Hillsborough County will draw down our testing sites at the Sun City and South Shore location this week. Additionally, our testing site at the Plant City location will also close next week on September 30th because of low demand and to allow the site to resume normal operations. At the current sites that will remain open are Raymond James, Lee Davis, USF, Brandon, Waimama, and we have our two mobile teams. The current sites that will remain open will continue to give us 2,100 tests per day capacity to continue conducting tests here in the county sites. Logistics, we have no PPE or testing kit shortages at this time. We have 0 guests in the quarantine site and 11 guests at the isolation site. And in up and coming weeks, we will begin evaluating our quarantine and isolation sites for right sizing and future operations. This concludes my update. Any questions?
Thank you, Mr. Dudley. I see no questions, so we appreciate your report. Thank you so very much.
Thank you, Mr. Chair.
Dr. Holt. Yes, sir, you're welcome. Dr. Holt, public health update.
Yes, sir. Good afternoon, Chairman Miller and Commissioners. This is Dr. Holt, the Florida Department of Health, Hillsborough County. Today we'll review our latest epi and hospital data. I'll share some observations. We're also going to take a look and review a little closer the past 4 weeks of our cases, sort of get a sense of a little bit more real time as far as the data. And then Mr. Wagner will conclude by reviewing our dashboard. So if I could ask for the first slide, please. So our case rate per 100,000, again, this is an indicator of sort of the degree of the level of transmission that's going on in our community, is now for the past 7 days at 86 per 100,000. This is a 10% increase than what we had presented last week, and reverses a bit of a downward trend that we had seen, as you can see over to the left of the slide as you look at it, where we have sort of reviewed where we were the past 4 weeks. So we remain in the orange zone, but we're now more in the middle than towards the yellow, which we would need to get down to 70 to achieve that level. This represents 41,178 total cases in Hillsborough County residents that have tested positive with both PCR and antigen, not antibodies. Our 14-day average of new cases is 173, which actually is an 8% decrease over 14 days. But again, 7 days is more predictive of the what's current. And we are now at 185. That's a 15% increase. So we need to see this trend reverse to avoid really going back up and higher to the orange, maybe even to the red, which we certainly do not want to get to. Our test positivity is at 5%. These cases over the last month have not translated into any significant increase in hospitalizations or deaths, which now number 619. But again, these are lagging indicators and that are influenced by a variety of factors, including the ages of people being infected. Again, I always note on the dashboard that our OCA data will show our ICU occupancy actually is higher. That we had, or overall occupancy, I should say, is 80% in the ICU, 90% in the beds, with 50% of our pediatric beds occupied. This really represents a normal occupancy for hospitals at this time of year, even without COVID. But as we approach October, and certainly as we move into November and December, hospitals routinely or historically will maximize their occupancy due to influenza and other factors. So as such, I've asked the hospital groups to come next week and sort of give us an idea about what they're going to be doing to prepare for this combination. And also, lastly, as far as the dashboard, I was on the last page. The school age cases continue to show our 0 to 4, 5 to 9, and our 10 to 4 age groups really having relatively low rates, about 3 to 4 times less than that 86 per 100,000 that we talked about for the general. Our 15 to 19, especially our 20 to 24, we're seeing higher levels, and we'll talk a little bit more about that later. Next slide. Regionally, with really the exception of Sarasota, the other Tampa Bay counties are also seeing some slight increases in their case rates per 100,000 over the last 7 days. On a percent basis of increase, Pasco has seen the largest increase. Generally, this is really not surprising. COVID-like people move across county borders, so it's always better to think of COVID as more of a regional challenge than individual counties. I also watch peer counties across the state, and South Florida, the big three, have shown significant improvement. So overall, our state numbers are looking better. We sort of mirror Palm Beach, but recognize Broward County has done an exceptional job. They are now in the yellow zone, and their lowest positivity rate was 3. Next slide, please. Again, looking over time, sort of where we were, what's been going on, but where we are now, we did add some additional dates, or a date I should mention. So we've noted the opening of schools, and Labor Day. We also included the emergency order that opened the bars on 9/14. So we're 4 weeks beyond our university and colleges opening, 3 weeks after our K-12 open, 2 weeks after Labor Day, and about 1 week after the executive order. And you can see at the far right, we're sort of seeing some rolling hills. So we came down nicely, and now we're sort of haven't seen some ups and downs. So we really wanted to take a look at that last 4 weeks, and I would ask for the next slide. So we compared we divided the 4 weeks into 2-week periods. This really gives us a little more confidence in analysis, but I would still note that this is a snapshot. It gives us some insights, but it's certainly not, doesn't give us certainty about things. It is a one-time look. So our first 2 weeks were from August 22nd, which just before the K-12s opened, all the way through Labor Day. And then we had, as you can see, 2,638 cases during that 2 weeks. Then we had next 2 weeks, which is just after Labor Day to present, and we had 2,423. So we have seen an 8% decrease over those 2 week periods. But you look at the bar graph, you can see that we did note that our 15 to 24 age group, really different from all the others, has shown an increase. And that's reflected in the table where you can see we had an increase in that age group of almost 30%. There was a slight increase, but very small numbers in the 75 to 84%, while the others have shown some downward trends. I would note that Hillsborough County has sort of always had, overall, our median age has been lower at 37 than other Tampa Bay and even other counties within the state of Florida. And I think as this data shows, we are seeing, expect that to go down cumulatively over time if this trend continues. Next slide, please. So we really wanted to take a real closer look at the 15 to 24. It's kind of it crosses both, I think, high school levels and into the young adults. So we looked at each year by case. Again, this is only a month period to 2 weeks period. And you see from the graph that the increase really, in the majority is in that the 18 to 22-year-olds. And if you look closer in the table, you can see that the especially significant in the 20, 21, and the 22. So, the number of our cases in this group in total, the 15 to 24, which represented 757, that's about 30% of all of the cases that we've seen in that 2 week period. And actually the 18 to 22, if you look at that group, they are about 25% of our total. So, and the 15 to 17, kind of the high schooler, if you will, they account for about 10% of this 15 to 24. So our message is simply focusing our education and to our young adults. We are still seeing a relatively high level of community-based transmission sustained for our CDC descriptions. Again, we're about 4 weeks after the university, so it's kind of not open. So it's kind of not surprising. We're seeing a bit of surge in these groups. It's not causation, it's just an observation. I think the K-12 group and under the 0 to 17 age or so, the schools are doing a very good job in class. The primary issues, if we're just going to see things, are generally events or gatherings really outside the school or in the besides their sanctioned extracurriculars. We're entering the period where we're going to expect, if you expect any increases from Labor Day, or certainly the opening of bars with the executive order, it'll be in the next several weeks. And I would ask everybody to continue the efforts. Social distancing, mask, they are safe, they're effective, they're recommended by all our public health organizations. Some increasing studies, even in the lab, that can document benefit. They should be worn when you can't social distance, especially indoors, closed spaces and crowds. With that, I'll stop there, Commissioner Miller, and either answer questions or go into Mr. Wagner, whichever you prefer.
Before Mr. Wagner makes his comments, Commissioner Overman has a question. Commissioner Overman, you recognize.
Thank you, Chair. And thank you, Dr. Holt, for your report. It's very helpful to kind of see what the trends look like. And it does appear as though while over, the aggregate, we're seeing a good decline in terms of all the different ages, but we are seeing in the environments where social distancing is quite difficult, our universities, our communities, and our schools, we're seeing an increase in numbers, as you had suggested we would about this time, given when the schools opened. I am concerned about that age range, although they have not been heavily impacted. If they are not being encouraged to quarantine, if they are returning back into the population and going back to school, or if they have other children in their households that are not being identified at the schools as being COVID exposed and tested, that could cause an underlying infection rate that we're not seeing. Can you share with me, is there any information available on the turnaround and the type of testing that's being done at the schools, whether that be USF or our elementary schools, what that turnaround time looks like as compared to what we're seeing, say, for example, at our county testing centers or at the hospitals?
They're very different. USF and I can't speak specifically for them, but they've taken a little more aggressive. They have some testing that they do routinely. They're doing small samples, random samples. They're doing some environmental testings. They have labs on their campus that give them results in that. So they're sort of in a different capabilities, if you will. In our K through 12, the access to testing it is essentially in our community testing. We have established a dedicated site, or prioritized site at the University Mall for our students, in particular, the staff of the public schools have access to very rapid testing through the Tampa General's urgent care sites. We're watching very closely any questions or concerns about secondary transmission within the schools or within their households. And again, with the exception of some extracurricular, particularly in high schools, we're not seeing secondary transmission into schools as of this time that we've been able to document, nor families, if you will, where the child brings them back. But we're early in the game. We're looking very closely at those follow-ups for those, the other students who are exposed, or ultimately their families. Most of the families, the cases individually that we've seen, are bringing it into school from their families, not necessarily taking it out at this time. And I'll stop there.
Great, thank you very much. I just am the 15 to 24-year-old, 29% increase from a week or so after school started to 2 weeks after is sort of an indication that the testing is catching infection that we may not have seen in terms of exposure levels before. I mean, when you do have access to testing, especially the college ages, they may not have thought about it before, but now they have the opportunity to get tested, and it sounds like they are getting tested, given the level of testing results that we're seeing in that age range. I do anticipate that we're going to see increasing numbers at our young people age, and I just wanted to say thank you to our citizens that are keeping our economy going by wearing the masks and social distancing and doing what they can to keep their customers safe in their businesses, and following the guidelines that are, is keeping the businesses that are able to social distance in their locations safe, so that people can come and do business with them. Because I think that's an important thing that we need to say is, those folks that are encouraging us to make sure that we keep the mask mandate in place, which are a significant number versus the calls that we get at this meeting, are very happy that they can keep their clients, their customers, and their employees safe, as well as their families. So thank you for the work you're doing, and I'm looking forward to hearing Mr. Wagner's report.
Commissioner Kemp, you recognize.
Thank you. I just wanted to speak to a couple of things. I know that I think Dr. Holt, you said 5%. Some of the people that were speaking in the beginning said 5%, but I guess right now it's actually something closer to 5.55% or 5.34%. Dr. Holt?
Yeah, and I think and Mr. Wagner will point out the dashboard it is only updating it every week, so the data is a little old. It's from I think 13. So I watched the daily ones myself, and we're right at 5% over the last 7 days.
Okay. At 5% or slightly above 5%? I'm just curious.
The dashboard says 5.55%.
Right.
Yeah. For 14 days.
Right. And so I just think that that's important to communicate. Also, of course, we've heard the World Health Organization and the Florida Medical Association and others have talked about a 5% rate, but a 5% rate is a top rate. I know at least the Florida Pediatric Association said preferably 3%. In New York, they've gone for 1% and have achieved that. So I think it's very, and I thank you, Dr. Holt, for reminding people again. It appears that the mask wearing, which has now been also continued decisively in Pinellas County as well as Pasco County, to continue this is what is seems to be bringing the social distancing, the mask wearing, the carefulness of people seems to be what is finally bringing these very, very high rates down. I'd also noted that I just looked quickly, as I do, for comparative information. And I watch, my daughter lives in Canada, so I watch Canada, which has 40 million people, twice as many as Florida. Today had 412 new cases and 1 death. Florida had 2,500 new cases and 172 deaths. I just think it's good to get perspective. Again, that's twice our population. As well, in Florida, it looks like it is spreading in quite rapidly, and I don't know whether they're doing mask wearing, but some of the small rural counties, for the first time ever, just today, every single county, no matter how small, some of them 8,500, have more than 500 reported cases of COVID. And when I did some quick calculations, Lafayette County, that means that 1 out of every 7 people have been identified with COVID. Gulf County, 1 out of every 15. Liberty County, 1 out of every 16. So it is still out there quite strong. I'm really glad that we are taking the precautions, and I really want to thank the citizens for doing such a great job with this. I do have one question. I don't know if you are familiar with this, Dr. Holder, have anything with regards to it, but today in the mail, I got a package from a big testing company, and it had a medical form on the top. I know this wasn't ordered by my doctor. My doctor's name wasn't on it. It said, so-and-so doctor ordered a COVID-19, and it's a saliva test, and it gave me something to mail it back. And I'm just wondering if you're familiar with this, or what this is, or if you can comment on it, because I'm sure I wasn't the only person in Hillsborough County to receive this today.
Well, I'd happy to take a look, a little more specifics to comment on that. Saliva tests are one of the advancing means of collecting the sample, and have shown to be essentially equally effective if the test is from a reputable approved. The FDA did approve a lot of people. They actually didn't approve any people as much as they just allowed them to use tests. So we've learned that not all tests are as good as in others, but I'd happily take a look at.
Yeah, it's a major lab company, and it didn't have any letter in it or anything. It had what seemed to be a medical form that they wanted me to sign. So this was ordered by this doctor that I don't recognize. So I was just curious, and I'll get in touch with you about that, but I just got it like an hour ago. So that's why I ask it here without having asked before. Thank you.
Okay, while you all are speaking of Canada, Canada is in their second wave of COVID, and they're starting to shut down the country again. So,
They have a low bar,
okay,
or high bar, I guess.
Mr. Wagner.
Yes, Commissioners, Kevin Wagner, Business Analyst, Healthcare Services Department at Hillsborough County. Good afternoon. I'd like to present the publicly available dashboard, COVID dashboard that's on the Hillsborough County's website. As indicated through Dr. Holt and the callers, total cases confirmed today is over 4,100 or 1,351, with a total estimated recovered of nearly 35,300. The case rate daily change, again, this changes every day. The dashboard was just updated at 1 o'clock, so it's a little bit different than what Dr. Holt reported. Essentially, the 7-day case range is nearly the same, around 177 versus the 181 that he presented a few minutes ago. The 14-day case change has gone down, again, just under 4%. And with regard to the testing for the 2-week period, we actually did see an increase of testing that I'll present a little bit later, but the 14-day average was 21,000 tests per week. So that was an increase from 7 days ago when we presented this. And discussed by the commissioners, the testing on the 14-day count is updated weekly, essentially on Sundays. So on the week finishing from September 13th to September 19th, that week, that 14-day count was 5.55%. As Dr. Holt alluded to, looking at a daily may be at that 5%, just above or just under the 5%. But on the 14-day count, when the data drops, it was 5.5%. Discussing the hospitalization, again, Dr. Holt indicated the hospitals are into their normal occupancy and capacity. Our data that's outlined here is again from the TGH data exchange. So there's always a little bit of a delay. Just as the reporting module from TGH gets updated, it hits the dashboard respectfully. But again, the TGH data exchange is a subset of all the ACA data, but it's a very large subset of the ACA data that's captured. Excuse me. I'll speak to the bottom chart with the cases by day. I think we all know where our peak was and where we have gone down from a flattening or declining. I think my observation looking at this today is, our downward is not going as down as what we were. We have down, we continue a downward trend, we continue a flattening trend, but that slope of the down has really slowed down, and we'll show that on another slide. But I think that's the key of where we are at 177 cases on a 7-day average or 176 on a 14-day average. Really, that slope has really degraded. Speaking on hospitalizations, again, looking at the slope on the bottom two charts, especially on the hospital census side, again, we see a large downward slope, and then now that slope is not as great. And I think that's the observation for the commissioners through Dr. Holt. We have gone through a downward motion. We are flattening, but again, it's more of a flattening, and that slope is really narrowed out. With regard to the cases by the population, again, we're at 41,350. That's almost 3%. It's 2.8% of the estimated population of 1.47 million. So again, it's about 3% confirmed cases. With regard to the testing summary by the week, speaking to the far right-hand side, last week was a very good week with regard to the testing of nearly 25,000, which was an increase from the previous week of 17,000. When we add those together and average them out, that is the 21,000 number that is shown and I've mentioned. But I think the good part about that number, when we look at the last 5 or 6 bars, it really is an increase in testing results that have been reported to FDOH. And the last grouping of the dashboard, again, as Dr. Holt indicated, this is the daily cases by age group. The top is the individual daily cases, so it has some variability in that. The bottom, which I'll speak to, is really the rolling 7-day cases per 100,000. Again, anything from 0 to age 14, we've seen really a minimum impact. It's the ages from 15 to 24 that have seen that upward climb that Dr. Holt indicated on the previous slides, and that we can visually see even on a 7-day component. So again, that's kind of where we're seeing the confirmed cases in the community. I'll stop there.
Okay, thank you, Mr. Wagner. Appreciate it very much. Commissioner Kemp, you recognize. Commissioner Overman, you recognize.
Thank you. Just a quick question. When you brought up the slide that showed the testing summary by week, it looks like in the week of mid-May, we were at 1.78%. And it really only took about 30 days to get to 17%. And this has more to do with the question with Mr. Dudley and the decisions to reduce some of our testing sites. If we're seeing a trend at our 7-day rate that shows a doubling, anytime soon, are we going to be able to ramp up the testing again? Should we need that? Should we start seeing numbers in that acceleration rate that we saw back in May and June?
This is Tim Dudley. Yes, Commissioner, absolutely. We've been going at this for up to 8 sites now. We've developed our plans along the way and set all our contracts in place. Also, besides the fixed sites that you see, we're working with 2 of our commercial companies, ambulance companies that conduct our mobile testing. So we still have that resource that we're operating in the background, and we'll continue to monitor that and working with DOH as if it's a requirement for us to ramp back up, we have everything we need to put something in place and get it going again as needed.
I appreciate that. And the reason I ask is, we are still in hurricane season, and it takes a couple of weeks for the numbers to show up. We have a large population of individuals, largely children, and teachers that are not able to social distance. And so about the time we're starting to see the impact of those decisions, we'll be, still in hurricane season. So I know you've got your plate full, and I just want to say thank you. But given that we might have to ramp up testing about the same time we might be facing a potential hurricane, I just thought I should ask. So thank you very much for all your hard work. I appreciate it.
Thank you, Commissioner.
Okay, Mr. Wagner, were you done?
Yes, sir.
Mr. Wagner? Mr. Wagner?
Yes, sir. Yes, sir.
Were you done?
Yes, I'm done.
Okay, thank you very much.
Thank you.
Thank you,
Commissioner.
thank you, Dr. Holt. Appreciate it. Thank you. County Attorney update, Ms. Beck.
Yes, good afternoon, board members. Christine Beck, County Attorney. In keeping with Florida law, we have provided a draft order extending the local state of emergency for your consideration. Would extend it for an additional 7 days. And at this time, Mr. Chair, it'd be appropriate to entertain any motions relative to that draft order.
So moved.
Motion by Commissioner Overman.
Second by Commissioner
Second by
Smith.
Commissioner Smith to extend the emergency order. Seeing no discussion, please call the roll.
Miller,
Yes.
Hagan,
Yes.
Kemp,
Yes.
Merman,
Yes.
Overman,
Yes.
Smith,
Yes.
White.
Yes.
Motion carried 7-0.
Okay. Is there any other business to come before us today? Any other business to come before us today? Seeing none, we'll see each other tonight at 6 o'clock. We'll adjourn.
Thank you so much.
See you this evening, everybody. Take care.
Thanks, everybody.
Take care.
See you.